One of the challenges for medical undergraduates today is the application of theoretical knowledge to the actual management of acutely ill patients. Students must learn to be systematic in their approach to a problem and develop skills appropriate to working in a clinical team. At BSMS, we provide access to a high-fidelity simulation suite, which gives students the opportunity to manage a realistic medical emergency scenario on their own in a safe environment. For example, in order to manage a patient with chest pain, students need to have a good understanding of parallel specialities such as cardiology to diagnose cardiac chest pain and respiratory medicine to diagnose pleuritic pain. It also requires knowledge of disciplines traditionally taught in different phases of the curriculum, such as physiology to interpret the blood gas result and radiology to interpret the chest X-ray. The high-fidelity simulator allows students to interact with the mannequin as they would in a real patient-doctor interaction and bring these skills together in one clinical scenario. The students are actively engaged in clinical learning and encouraged to make decisions, initiate appropriate investigations and prioritise patient management. Within the control room, each scenario will be observed by a member of the clinical skills and simulation team, along with a senior clinician, which offers the opportunity for immediate student feedback in a post-scenario debrief. The observation room allows fellow students to watch the scenario as it evolves and participate in the debrief. This process helps students to generate individual learning goals from their own specific scenario, which subsequently supports not only their clinical understanding of a topic, but also means that they can readily see the relevance of certain issues. Medical education research spanning at least 4 decades demonstrates that simulation technology used in the right conditions can have a large and sustained effect on knowledge and skill acquisition among learners. Because of this, it is utilised right across the continuum of medical education, from undergraduate right through to senior postgraduate level within all specialities. Regardless of the level of training, the student feedback at BSMS remains consistently positive.
The clinical skills team here at BSMS are fantastic. The team help you out a lot during your clinical skills years using this simulation suite and all its facilities.
The clinical skills team and simulation suite helps you prepare for assessments throughout medical school. Having just done my finals and the initial assessment coming up many times, it made it more comfortable in a pressurised situation.
Being part of a small medical school, we can freely send emails to them with queries and questions and they readily reply. They know us on a first name basis, which provides a supportive learning environment.